Kind of the golden egg in plastic surgery has been cellulite. Cellulite is caused by a fibrous band that connects from the deep tissue, like the muscle fascia, up to the skin, and by pulling on that forms a little dimple or dent or wave in the skin. We really finally have a very reproducible, easy, simple sort of technique to correct cellulite. It is really the first non-laser based, mechanically operated sort of device that selectively releases the bands that cause cellulite. In the past, treatments have been really focused on the skin, trying to smooth the skin out, but nothing really has been targeted to release those bands. Cellfina is basically a small little microblade. The surgery is done under local anesthesia, and the little microblade goes in and selectively divides the little band, and so there's an immediate release of the skin and correction of the dimple. The results are very impressive. They're actually very immediate, so you actually see the result immediately on the table. It is the best technology for a number of different reasons. One, it treats areas that have been previously very difficult to treat. So the buttock area is kind of a laser or liposuction no-go zone. And so for the buttock area where cellulite is very prominent, or the upper thigh, it's very good. The current techniques really use lasers to treat or try and release the bands. The issue with that is the laser also kind of melts fat and tightens skin, which is actually the opposite effect that you want with cellulite. You want to release the bands that are creating the problem, but you don't want to do anything that's going to contract the skin. The question is this a one-shot deal or not? As far as we know, it actually is. And so it's not something that the cellulite or the bands reform. So once they're lysed, the skin relaxes and there's no kind of recurrence of the dimpling.